Hi viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on Dourine, which is also known as covering disease, morbocoital maligno, Slepsiecti, Bescalciosh, Slushnia buline. In today's lecture, we will cover the information regarding the Dourine, the organism that causes this disease. We'll also talk about the history of the Dourine, how the organism is transmitted, and the clinical manifestation of this disease. Finally, we'll address the prevention and control measures and actions to take if Dourine is suspected. Dourine is caused by the protozoan parasite Trypanosoma equiperdum. This organism belongs to the subgenus Trypanozoon and salivarian section of the genus Trypanosoma. It is very closely related to the Trypanosoma brucei subspecies brucei, Trypanosoma brucei subspecies gambians, Trypanosoma brucei subspecies rhodesians, which cause African trypanosomiasis in a variety of species, and Trypanosoma evansii, which causes Surra disease. Strains of Trypanosoma equiperdum vary in the pathogenicity. Dourine is believed to have originated in Asia and may have been introduced into the Europe through the importation of the Arabian stallions. Outbreaks were reported in Germany, France, Austria, and Switzerland, as well as in Algeria. Dourine was once widespread, but it has been eradicated from many countries. Currently, the disease is endemic in parts of Africa and parts of Asia, including Russia. The outbreaks of the cases are occasionally reported from other areas, including the Middle East and the Europe. Dourine mainly affect horses, donkeys, and mules. These species appear to be the only natural reservoirs for the Trypanosoma equiperdum. Zebras have tested positive by serology, but there is no conclusive evidence of the infection. Ruminants do not seem to be susceptible to the isolates from equids. Dogs, rabbits, rats, and mice can be infected experimentally. The incubation period is a few weeks to several years. The symptoms vary with the virulence of the strain, the nutritional status of the horse, and the stress factors. The clinical signs often develop over the weeks or months. They frequently wax and wane. Relapses may be precipitated by stress. This can occur several times before the animal either dies or experiences an apparent recovery. Genital edema and mucopurulent discharge are often the first signs. Mares develop a mucopurulent vaginal discharge and the vulva becomes edematous. This swelling may extend along the perineum to the ventral abdomen and the mammary gland. Vulvitis, vaginitis with polyuria, and the signs of discomfort may be seen. Raised and thickened semi transparent patches may be seen on the vaginal mucosa of some mares, and swollen membranes can protrude through the vulva. Edematous patches called silver dollar plaques up to 10 cm diameter and 1 cm thickness may appear on the skin, particularly over the ribs. These cutaneous plaques usually last for 3 to 7 days and are pathognomonic for the disease. They do not occur with all the strains. Neurological signs can develop soon after the genital edema or weeks or to months later. Restlessness and weight shifting from one leg to another is often followed by progressive weakness in coordination, and eventually the paralysis. Facial paralysis, which is genitally unilateral, may be seen in some animals. Conjunctivitis and keratitis are common, and in some infected herds, the ocular disease may be the first sign of Dourine. The anemia and intermittent fever may also be found. In addition, the Dourine results in progressive loss of condition, predisposing animals to the other diseases. The affected animals may become emaciated, although the appetite remains good. The symptoms suggestive of Dourine include genital edema and neurological signs. Silver dollar plaques, if present, are pathognomonic. Diagnosis can be difficult in some cases, particularly in the early stages or during the latent infections. The differential diagnosis includes coital exanthema, surra, anthrax, equine infectious anemia, equine viral arthritis, and causes of purulent endometritis such as contagious equine metritis. To prevent the Dourine from being introduced into a herd or region, new animals should be quarantined and tested through serology. When Dourine is found in an area, the quarantines and the cessation of the breeding can prevent the transmission while infected animals are identified. The Dourine can be eradicated from a herd using serology to identify the infected equids. Infected animals are euthanized. In some cases, stallions have been castrated to prevent the disease transmission. However, the geldings can still transmit the disease if they display the capillary behavior. The Trypanosoma equiperdum cannot survive outside a living organism and dies quickly with its host. If necessary, this organism can be destroyed by various disinfectants, including 1% sodium hypochlorite, 2% glutaraldehyde, and formaldehyde, as well as the heat of 50 to 60 degrees Celsius. The successful treatment with the trypnocidal drugs have been reported in some endemic areas. However, the therapeutic regimes have not been thoroughly investigated, and the treatment is usually discouraged due to the fears that the organisms will persist inapparently. Good hygiene should be used at assisted matings. No vaccine is available. Well, with this, we are going to end our today's lecture. Thank you so much.